Hi everyone, I want to talk to you today and break down the costs of what you might be hearing out there in terms of my Medicare for All bill. But I wanted to start by turning that question around and saying, what exactly do we spend currently on our healthcare system? Well, today in this country, we have the most expensive healthcare system of any industrialized country in the world, and we are spending $3.9 trillion a year. And that is projected to go up to almost $5.5 trillion a year. That's what we currently pay in healthcare costs. Now, let's look at Medicare for All. There are some libertarian, conservative think tanks out there that have thrown out numbers like $29 trillion, $32 trillion over the next 10 years. Let's take the higher end of that. $3.2 trillion per year for a Medicare for All bill that would cover everybody in the country with comprehensive care. If we implemented my Medicare for All plan, we would save trillions over the next 10 years. So now let's talk about who's paying for these costs of healthcare right now. Right now, the U.S. government is providing 2/3 of the current healthcare costs through Medicare, Medicaid, and federal subsidies for private insurance. What about this other third right here? Well, actually, the American people and employers are the ones footing the bill. $1.3 trillion that is being paid for by employers and by individuals poured into private insurance premiums, copays, and deductibles. So I just want to break this down in terms of how it works for an average family in the United States. The average family who's purchasing healthcare on the marketplace is paying about $10,000 per year. And if they meet their deductible, they actually end up spending about $18,000. And what about our businesses? 60% of Americans receive their insurance, health insurance, through their employer. And on average, for that business or that employer, the cost is about $30,000 for a family of 4. Instead of pouring it into private insurance companies, it would just go to a government insurance plan. The government would pay, and you wouldn't have to deal with 5 different insurance plans. You wouldn't have to figure out which hospital is in network and out of network, but you would have comprehensive care. No premiums, no copays, no deductibles. So now we've talked about the overall costs and who's paying and all of that, but the other piece that we need to talk about is why are these costs so high? And one of the biggest reasons is administrative waste. These private for-profit insurance plans have about 25% of the cost of those plans is just administrative waste. So 25% of all these premiums that go to these private insurance companies just go to administration. Well, let's look at what it costs Medicare, which is our government insurance plan that currently covers insurance for tens of millions of seniors and is adding thousands of seniors on Medicare every single day. Let's look at those administrative costs. Those administrative costs for Medicare are 2%. So look at this enormous difference in terms of what these private insurance plans are spending. And then look at CEO salaries. The United Health CEO, $82 million. Other CEOs, $52 million, $48 million in salaries. And a lot of that is this administrative waste. So if we can cut out that administrative waste, then we start to come down on the costs. So there are lots of ways for us to actually use cost containment measures and bring down the costs and make sure that ultimately we're streamlining a government insurance market that allows us to really negotiate the best prices and to make sure that people get comprehensive care. We want every American to have health care. And now you're going to understand a little bit more about how the costs work. And the next time you hear that Medicare for All is too expensive or that it's $32 trillion of new money, you're going to be able to fight right back because we broke it down.